Endometriosis is something that a lot of women are battling with. And if you did not know, March is Endometriosis Awareness Month. So we're going to be talking a little bit about it tonight. And specifically with endometriosis, you may be wondering, why is a physical therapist talking about this topic? Well, it's because a good number of women I see actually battle with endometriosis and related symptoms. So a lot of people hear it and they think that it only involves having painful periods, heavier cycles, and that it's only related to that time of the month. Well, it's so much more than that and so much bigger that we have to discuss things that you should know when navigating and trying to understand endometriosis. The first thing I want you to understand is that your pain is real. So if you're someone who's battling it, if you're an endo warrior, your pain is real. And there are different things that you can do to help navigate your life, navigate the situation so that way you can live with less pain. And also, I want you to know when it comes to endometriosis that yes, physical therapy is an option with helping to manage the symptoms. Unfortunately, we do not have any cures right now for endometriosis. So even though I love helping women with endometriosis navigate and manage their pain, unfortunately, physical therapy is not a cure. But you heard me say we currently do not have any cures at this time. So providers who are still telling patients that a hysterectomy will cure their endometriosis, they're wrong. If someone's telling you that hormone suppressants such as birth control will help to cure endometriosis, they're wrong as well. And the same goes for pregnancy, because I've had some women tell me, well, my provider told me if I get pregnant, that will help cure my endometriosis. All of that information is unfortunately false. So it is important to know that right now, currently where we are in 2026, we do not have a cure for endometriosis, but we're hoping that as science continues to progress, that will change. Now, you heard me mention all of those different things. And when it comes to hysterectomy, when it comes to birth control or other hormonal suppressants, or even pregnancy, then there are times where it may decrease your symptoms, but it will not cure the actual disease process. So depending on what is going on, whether or not you want to try birth control or whether or not you decide to proceed with the hysterectomy, that's a conversation for you to have with your provider. So that way you can weigh the risk and benefits and make the best decision for you. When it comes to treating endometriosis, the current gold standard remains surgery, and that's the excision surgery where they're actually cutting out the tissue, cutting out the lesions, and allowing for the body to have time to heal. So you heard me mention excision surgery is the gold standard. There are times where ablations, which is where you're actually burning more so the superficial or top layer of the lesions, where those will be incorporated in conjunction with an excision. But an ablation should not be the only response or only treatment when it comes to surgery, because that is not the best option. And we notice that women tend to have if not a progression, but a return to symptoms much sooner. So now that you have an idea a little bit about endometriosis, you heard me tell you, hey, it's not just about painful periods and also heavy cycles. You heard me tell you that we currently don't have any cures, but you also heard me mention some easy things that you can do, including physical therapy, movement, having those conversations with your doctor to see different options as to whether or not hormonal suppressants are an option for you. There's some other things that you can do to help manage pain, including diet modification, lifestyle modification, stress management, those different things. So be mindful that yes, we can manage your pain and yes, we can get you feeling better, but also be mindful that right now, if someone's telling you that there's a cure in 2026, currently we don't have it. But when it comes to endometriosis, a lot of women go years before they receive the appropriate diagnosis. And most of these women actually have GI-related symptoms to start off with. When I say GI-related, I'm talking about your gastrointestinal system. So these women are complaining of symptoms that are very similar to IBS, so irritable bowel syndrome. And oftentimes they're diagnosed with irritable bowel syndrome, or they may even be diagnosed with chronic constipation. Because we know that with irritable bowel syndrome, that individuals can have, times where they have really loose stools and diarrhea, and other times where they more so suffer from chronic constipation. So with endometriosis, one of the first signs that is oftentimes missed comes to the GI system. So if you're noticing that your periods are really painful, if you're noticing that your cycles are really heavy, and you're also noticing, hey, I have GI symptoms, it may be worth having a conversation with the provider to at least find out more information to see if you have anything else that may correlate and indicate that you could have endometriosis. And outside of just painful periods, there are many women who have pain and who have symptoms outside of their cycles. So sometimes women will start off having, just pain just around the time when they're menstruating within that cycle that occurs roughly every, between every like 24 to 35 days, somewhere in that range for your cycle. There's some women who will have pain just within that short period of time where they're menstruating. Well, sometimes it progresses outside of that, where they'll actually have pain more consistently and all of the time. So being mindful as to what your body is feeling. And when I say period pain, I mean you actually have pain that's preventing you from participating in certain activities, pain that's taking you out of work, taking you out of gym class, taking you out of school, preventing you from being able to do things that you enjoy. That is not normal. You should not be curled over into a ball. You should not feel like as if you're getting stabbed into the stomach or into the gut. That type of pain is not normal. Normal menstrual discomfort, hear the difference in terms. Normal menstrual discomfort is mild cramping. And mild cramping we can expect because the uterus is a muscle, and as it is contracting, it is actually shedding its lining. So we can expect some mild cramping. But pain that most women with endometriosis experience, that is something we do not want to see. So if you're having really painful cycles and it's preventing you from doing certain activities, if you're noticing that sometimes you just have to curl up in a ball, then I want you to have a conversation with your provider. Ask more questions. That way you can figure out what is going on, because menstruation should not be painful. It may be uncomfortable because of the cramping, but mild cramping, but it should not be painful. Another sign that typically happens with women with endometriosis related to pain and also related to your GI health is that they have painful bowel movements. So if it hurts to poop and you're also having some of these other symptoms, another thing that you need to bring to the table when you go to talk to your provider, because a bowel movement should not be painful. You should be able to relax those muscles and also be able to pass stool without forcing it or without straining on the body. Okay. So you should not have to bear down in order to pass your stool in order to have a bowel movement. There's some women, in addition to the GI symptoms, where they also will have bladder symptoms when it comes to endometriosis. And bladder symptoms can be hard to tease out because there are various things that can contribute to similar symptoms within the bladder, such as, inflammatory pelvic disease, where individuals actually have inflammation in this region. And then also having a urinary tract infection, where that UTI, where individuals have a buildup of bacteria, excessive amounts of bacteria, I should say. And then also individuals who may notice it just have like increased urgency. They may notice that it can be hard sometimes to relieve the bladder related to something called interstitial cystitis. So interstitial cystitis may be related to endometriosis because there are some women with endo who are more prone to it. But we have to really tease out some of those bladder symptoms. So if you're having bladder symptoms and you're having some of the other things that I mentioned, same thing, talk with your provider, even find a urogynecologist to help you so that way they can best navigate. A gynecologist is going to be more familiar with the reproductive system. A urogynecologist is going to be familiar with the urinary tract and the reproductive system. Okay, so just to give you a little tidbit as to who you should probably be looking for, either one can help, but sometimes you may get a bit more specific information related to the urinary tract if you see a urogynecologist. So we talked about how women with endometriosis, how they may have, more painful cycles, they may have heavier bleeding. We talked about how these women also may first present with digestive-based, those GI symptoms, and even the bladder. Now, one thing we don't think about is that a lot of women with endometriosis, because of the chronic pain, there may be some mental health involvement as well, because depression can set in when you're in constant pain, especially if you have providers who are not listening to you. You heard me mention earlier that a lot of women, it takes time to diagnose, and that can be anywhere between 8 to 10 years. Some women start having symptoms, and then 8-10 years go by, they finally have a diagnosis. Why does it take us so long to diagnose endometriosis? Because a lot of times providers aren't asking the right questions, and more providers need to understand and ask about normal menstrual health. More providers need to understand and ask about other symptoms and start drawing the kind of like connecting the dots to make sure that we are seeing the whole person and not just individual systems within the person. It never fails. I've seen so many women in the clinic where they'll come to me and they're like, oh, my period is extremely heavy and extremely painful. I have them tell me what heavy means, because heavy can be, really confusing if you don't know. And when they tell me, no, I'm soaking through a pad every hour, okay, that is extremely heavy. And some days I can't even get out of bed because I'm in so much pain. Now we have 2 check marks: heavy period, a lot of pain preventing activities. And they're like, oh, and I sometimes get really constipated. Other times I have really loose stools. I'm not really sure what's going on, but I have a lot of abdominal pain. Check, check. Oh, and now that I've been in pain for this number of years, no one's really seemed to listen. And now I have pain in other areas as well. Well, what happens is these women, they go see different providers for each individual system, and no one connects the dots. So it's important that we take the time to listen and that we begin to start connecting those dots to help these women get the treatment that they need. So endometriosis is so much more than just a painful period. It is a systemic based disease. So it is something that occurs it more so starts within the reproductive region, but it can be anywhere in the abdominal or thoracic cavity. And there's studies that are indicating that it migrates down in some cases into the legs, and also may be higher up within the body as well. So knowing that endometriosis does not just stay localized to the abdominal region, we need to take this into consideration when these women are presenting with various symptoms. So before we just go ahead and slap a label on someone, let's make sure we're asking the right questions. And more importantly, before we just dismiss other symptoms saying that they're probably not related, make sure you take the time to understand the whole picture. And sometimes it takes several providers in order for us to get the full full capture as to what is going on with the patient. So take the time, make sure you're listening. If you're an endo warrior, make sure you're speaking up as well and advocating for yourself, because your pain is real. Your pain is not something that is just in your head. Unfortunately, some women have been told that as well. So make sure you're speaking up for yourself. Make sure you're finding a provider who's willing to listen, because a lot of times when we suspect endometriosis, we can give like a preliminary idea to the individual saying, hey, there's a chance you may have this. You check these number of boxes. This is what's going on. And in order for them to truly diagnose right now, we are still relying upon surgery, where they also can start to remove the tissue. So be mindful. Providers, make sure we're listening to our patients. Patients, continue speaking up and find providers who will listen to you, because endometriosis is so much more than just painful periods and heavy menstruation. Endometriosis impacts the entire body. It impacts your mental health, and it can cause pain in areas outside of the abdominal region. Let me know if you have any questions about endometriosis. More than happy to answer those questions for you. And also, if you need resources as far as finding an endometriosis provider in your location, let me know that as well, and we can put you in contact with someone. Thanks for joining.